Welcome back. It's 8:15 right now. So this year's flu shot appears to be a pretty good match for the strain going around, and it's more likely to keep you from becoming severely ill. So the CDC is saying that there's been a 35% drop in hospitalizations for people with the flu, even though the season really kicked off a lot more aggressively. The agency will have more definitive data later in the season, but right now is hoping that these stats convince people to get their flu shot because flu vaccination rates have been down so far. Top experts from the CDC and the American Medical Academy join us live this morning to talk more about the flu season. Doctors Chastity Walker and Willie Underwood, good morning, you two. Thanks for being with us.
Good morning.
So, Dr. Walker, let's start with you. Can you talk about the current flu season? I mean, how does this season compare to what we've seen, especially in the past few years?
Well, thank you for having us. Actually, this week is National Influenza Vaccination Week, and the perfect time to talk about flu because we are seeing unseasonably high rates of flu and flu cases for this point in the season. We've already seen nearly 9 million flu illnesses, 78,000 hospitalizations, and 4,500 deaths from flu. And so we really are encouraging Americans to get vaccinated ahead of the holiday season to reduce the risk from flu and potentially serious complications. The rate of flu hospitalizations at this point in the season is the highest that we've seen in the last decade.
Wow. Dr. Underwood, we did just get that CDC info this morning that this year's flu vaccine is a pretty good match when it comes to the flu strains going around. Can we talk more a little bit about that?
Yeah, you're absolutely correct. We got it right. This vaccine works well with the current flu in our environment. The only problem is that people aren't getting it. All right, so we need you to get the vaccine, which will decrease your risk of getting the flu, decrease hospitalization, decrease deaths, decrease time off from work, or increase hospitalization costs or healthcare costs. But not only that, though, it will allow you to enjoy the time of the holiday seasons with your families and not have to worry about being hospitalized or dying from the flu.
And, Dr. Walker, I mean, we heard this a lot with the COVID vaccine as well. I mean, there's a ton of vaccine misinformation that goes around. People are skeptical about vaccines. They don't want the flu shot. What would you say to those folks?
Well, I would say getting a flu shot is the one thing that we can all do to help slow the spread of flu and keep ourselves, our families, and communities safe and healthy. We've had more than 50 years of experience with the flu vaccine, its safety and effectiveness. And as Dr. Underwood mentioned, the vaccine for this year is highly effective in reducing hospitalizations by as much as 60% in serious complications. So we want to recommend that everyone 6 months or older get a flu shot. Older adults, 65 years and older, pregnant people, and particularly people who may have other chronic conditions, racial and ethnic groups, Black and Hispanic people who have shown to be at higher risk of severe illness from the flu and have lower rates of vaccination. It's not too late to get your vaccine, your flu shot, if you haven't already gotten one.
Doctors Chastity Walker and Willie Underwood, thank you so much for being with us this morning. We appreciate your time.
Thank you.
Absolutely.